Hi, I'm Seni Malvarganam, a consultant breast surgeon, and today I'd like to talk to you about the essentials you would need to know about nipple discharge. So patients would need to know about the following aspects with regards to nipple discharge, and I've broken it down into my sort of 8 key points. So point number 1, what is normal versus abnormal discharge? Well, nipple discharge can be normal, especially during pregnancy, breastfeeding, or certain times of the menstrual cycle. However, persistent or spontaneous discharge, particularly if it is bloody, clear and watery, or appears greenish, may indicate an underlying issue and should be evaluated by a healthcare professional. So number 2, what are the possible causes? Well, nipple discharge can be caused by variety of factors, including hormonal changes, benign breast conditions such as fibrocystic changes, infection, medications, and in rare cases, breast cancer or other serious conditions. It's essential to determine the underlying cause through proper evaluation and appropriate diagnostic tests. So point number 3, associated symptoms. Patients should pay attention to any associated symptoms, such as changes in breast size or shape, breast lumps or masses, nipple changes such as inversion or retraction, breast pain, redness or swelling. These symptoms may provide important clues about the underlying cause of nipple discharge. Point number 4, evaluation and diagnosis. If a patient experiences persistent or concerning nipple discharge, they should seek evaluation by a breast specialist. The evaluation may include a medical history review, physical examination, imaging tests that can include mammography or breast ultrasound, and possibly even a breast biopsy to determine the cause of the discharge. Point number 5, what is the breast cancer risk? Well, while most cases of nipple discharge are due to benign causes, in some instances it may be associated with breast cancer, particularly if the discharge is bloody or unilateral, which means affecting just one breast. However, breast cancer is a relatively uncommon cause of nipple discharge, particularly in younger women. Point number 6, treatment and management. So treatment for nipple discharge depends on the underlying cause. Benign causes may not require any specific treatment, while infections may be treated with antibiotics. In cases where breast cancer or other serious conditions are identified, appropriate treatment options will be recommended based on the individual's diagnosis and overall health. Point number 7, follow-up and monitoring. Patients should follow their healthcare provider's recommendations for follow-up appointments and monitoring, especially if they've been diagnosed with a benign condition or are at increased risk of breast cancer. Regular breast self-exams and mammograms, if appropriate, may be recommended for ongoing breast health surveillance. And finally, number 8, seeking support. Coping with the concerns about nipple discharge or undergoing diagnostic tests can be stressful. Patients should seek support from loved ones, healthcare providers, or support groups to address any emotional or psychological challenges they may face during the evaluation and treatment journey. I hope all this helps, and I wish you all the best.